Dr. Pablo Rubino. Welcome to Neurosurgery Tales. It's my absolute pleasure to have you here and discuss your philosophy and your thoughts about neurosurgery and everything.
Okay, thank you very much. It's my pleasure to be here talking to you.
Thank you. My first question is always what inspired you to become a neurosurgeon when you decided you want to do brain surgery?
Well, it was many years ago, uh, just at the beginning of my career at the School of Medicine in my province. I was impressed by not exactly for neurosurgery. I was very I feel attraction about neuroscience. Uh,
Hmm.
Even I was thinking in my first year to to research or to study neuroscience. I mean neurology or neurosurgery. Maybe at the end of uh, my training in School of Medicine, uh, finally I decided for neurosurgery because I think it was even more challenging
Hmm.
than neurology. I thought that there was and there is many things to discover and to learn to if somebody wants to study or to practice neurosurgery. So I think it's one of the most attractive, most challenging specialties. Um, Now, after 20, more than 20 years, I think that I was correct. My decision was totally correct.
It took you a long time.
Yeah.
Your work has clearly had a significant impact in the field. And during my hands on courses, I met neurosurgeons who were comparing your work, pictures of your work, with the actual dissections they were doing. And they were aspiring to achieve the same excellence as you have.
Mhm.
And it's evident you've set a benchmark of what can be done in the surgery, in the field of neurosurgery. And with that in mind, I'd love to know more about who your own role models are and who influenced your path.
There is no question for me, and maybe not only for me, maybe for many others neurosurgeons around the world, especially in uh, South America. Uh,
Hmm.
the inspiration was Dr. Evandro de Oliveira. There is no question about because I think that Evandro, I said again, not only for me, for
Hmm.
many other neurosurgeons, he was the person who best understood and mixed the philosophy of the microsurgery coming from Professor Jasarhi and the
Hmm.
anatomy that was promoted by Professor Roton. So he could fix both and put in the operating room in the patient. And if you have the opportunity to watch Professor Evandro's surgeries and
Hmm.
lecture, you will see that maybe he was the first person who could make a real or actual microsurgical dissection, like anatomic cadaveric dissection. I spent many time with Professor Evandro in live courses in Brazil, in other part of the world, in our hospital. 5 times we did it, and I can corroborate that
Hmm.
is totally true. His dissection in surgeries just like a anatomic dissection. It's a good philosophy because if you can preserve the anatomy in the patient in the real case, you have there is high possibility that
Hmm.
the result will be very good, as Evandro used to have. And I just try to follow Evandro's philosophy. Not only follow, but also I try to spread and uh, keep this philosophy with all the people that are working with me.
And
There are another surgeon I respect a lot around the world, but this was maybe the most important for me. This was my model, Evandro de Oliveira.
he was definitely one of the greatest neurosurgeon.
Yes,
Um,
I
in,
think he reached the highest level.
you have also mentored a neurosurgeon from around the world, one of the best ones. And what qualities do you believe seeing them that can differentiate a good neurosurgeon or from a really, really good neurosurgeon?
I saw many good surgeons in Latin America, in Europe, Turkey,
Hmm.
and in the US. Of course, there are very good. Uh, Maybe one condition that I can in Japan, of course, Japanese neurosurgery is for me one of the best, and I think that one uh, fact that is passion. All of
Hmm.
them they love that we do. So this is, I think, that the first requirement you need to become a good neurosurgeon. Maybe for the rest of the activity in your life, but we are talking about neurosurgery. I think it's passion. Passion is the first condition, and I can see passion in all of these uh, surgeons that I follow. And you can see passion because they want to improve many times. They love anatomy. They want to to teach and learn at
Hmm.
the same time. So this is for me one fact that is clear. I can identify in this area, and then you have another step. You need to passion, obviously talent. Obvious, it's very important to have courage
Hmm.
and tenacity. These are, I'm sorry, I will say it again, these are Evandro's recipe, passion, tenacity, talent, and courage. And if you have these four facts, you will be a great neurosurgeon.
Do you think talent is something that you were born with, or it can be perfected and learned along the
Yeah,
way?
I think that the answer could be both.
Okay.
You can, yes, you work with the talent, and then if you love what you do, if you have if you want to reach a goal and you have the passion to reach a goal, I am sure that you will get more talent, or your talent will improve, will increase. The
Hmm.
condition that you have to love not only what you do, you have to love you, or you have to love what that you want to reach. Okay,
Hmm.
talent, you have a talent, but if you love, you want to be much better, you will you will train, you will read, you will teach, you will travel to see another person, and then your talent will improve, I'm sure. So my answer is both. Talent is not only skill. I mean, talent is,
Hmm.
if you have a very strong personality, this is talent. Hmm? Could
Hmm.
be
And
in different way. Yes.
well, we were talking about all these qualities, and it seems to me like a lot of them are similar to leadership in neurosurgery, because it's is and leadership is as essential as technical skills. What do you think are the most essential and effective way of being a leader in this field?
I think that there are many issues that you need to complete to become a leader. Not only be a skilled surgeon. Uh,
Hmm.
I think that this is important part, but you have to take care of the people that are working with you. I mean, not only the resident, the staff. No, I mean all the team. the resident,
Mm-hmm.
staff, secretary, patient, another physician from another sector. People are working with you.
Mm-hmm.
You have to take care of them and try to teach all of them, and then you have to keep them happy, and you need to stimulate the people. Try to find new things in your department.
Mm-hmm.
I think this is the leader, and help
And
in any aspect of the life. Not only surgery. It's not only surgery. Surgery is
mm-hmm.
most important for us. It's not only surgery. It's uh, how can I say, personal relations with everybody. We need to keep all of them. I am with the people I am working. I am not only worried about how they are doing the surgery. How do you feel? What do you think we can do to be much better? To what another technology we can incorporate? What is in neurosurgery is so wide now. There is
Mm-hmm.
thing you want to do, you can do. Not only in my case, I do microsurgery, but
Mm-hmm.
I am asking you need to study anatomy and try to find lab to practice anatomy, and then what are the area that are you more interested in, and then try to find a place um, that the people working with me, I am always uh, I always thinking how to have the people with you uh, happy and stimulate.
Mm-hmm. And of course, it's neurosurgery, and sometimes there are situations when surgical outcomes are not as initially expected. How do you handle these situations?
Okay, this question is a little bit hard because um, the, the thing I try to manage is for me the best way is avoid it. So
Mm-hmm. Yeah.
it, of course, sometimes we have the result that we didn't expect, or can I say the bad result, but the, it's very difficult, and I think that I feel so sad and so bad when I have a complication. So the first thing that I do is try to avoid.
Mm-hmm.
So I prepare the case carefully and discuss the case with my team. Uh, this is the best way to, because I think the best way to not to to not to not have this feeling is avoid it. But when I have the problem, I think the first thing is just to make a self question: what was wrong, what I did that it was in incorrect way. Then if I don't find any mistake, say what this is part of a medicine. I know that, and
Yeah.
then it's very important to talk to the family
Mm-hmm.
previous to the surgery, especially previous. You can talk about all the problems that we can potentially find
Mm-hmm.
during after the surgery. So the first thing is to talk with the family, but and the patient before the procedure, and then you need to talk after the procedure. If you have a problem, just tell that it was a problem. Just tell the truth, and follow the patient and family, and try
Mm-hmm.
to. Um, I usually I fight at the end of the case. I try to do everything that I can do. I talk to the ICU physician, to many people that are involved in the case, um, and then uh, when I have this problem, sometimes uh, I just, how can I say, I feel very bad, especially the first 2 3 weeks. The first week is very difficult, but on the other hand, I know that it's something that can can have in some cases, especially when we are doing complex cases.
Mm-hmm.
Cerebrovascular surgeries and skull base, that are my most frequent cases that I have. You know that you are doing something very difficult, complication or bad result, unfortunately, is something that can be expected in some cases. I should be honest, this extremely infrequent in my team, but
Mm-hmm.
unfortunately sometimes happens, and it's very hard.
And before you talk to the patients and their family about the procedure and all the discussion that we should have with patients before any complicated cases, how do you properly balance truth against hope when talking to them? How not to give too much hope if it's not the case, and at the same time telling the truth?
I think that you can say, or you can say both, the truth and the hope. But the truth is, I think that is always the truth first, 100% of the case,
Mm-hmm.
and hope is relative. Uh, I can tell you about my result to the patient,
Mm-hmm.
and another hand, according to the pathology. Because if you have a patient with you know less than 7 millimeters aneurysm, incidental one, I think that
Mm-hmm.
in my experiences I have a very good result. Maybe most of the cases are uh, uh, are delivered I delivered at home 3 or 4 days later. This is my result, and maybe the of many people. And in this case, I would say the patient, the most probably is that you will be very good, and you will we can resolve your problem. Okay, but
Mm-hmm.
on the other hand, you can have a patient with a high grade aggressive glioma, and it's according to the tumor location. In this case, surgery is still the best tool we have. I would say,
Mm-hmm.
according to the location, is in the prefrontal area. We said that I can take out the tumor with the safe supratotal resection. Maybe you can do very well, but the prognosis in the future is a little bit complicated. So I will not say the patient. I would say the truth, but on the other hand, I hope I will tell that maybe you will need another therapy to
Mm-hmm.
try to control the disease. The prognosis is sometimes is not so good. You need to complete something like that. Hmm? Because I don't like I don't like I don't like. But but
Yeah.
it's important to keep the hope in the patient.
Mm-hmm.
Keep the patient with the strong, not only physical but also emotionally strong. So if you say, I think that we are not allowed to say, because it's no, say you're gonna die, something like that. I think this is uh,
Yeah.
it's a mistake.
Mm-hmm.
We are not in the position to say something like that to anybody, because uh, we are only physician. I don't think that we are allowed to say something like that.
Mm-hmm.
I think it's totally incorrect.
Absolutely. And for those who are just starting their practice and probably um, will meet their first complicated cases and probably tying patients, do you have any advice or guidance how to talk with these people, with these patients?
Okay. It's maybe uncommon situation that you are telling me, because the patient, when you are talking about, for instance, a complicated disease, at
Hmm.
the beginning, they don't. I think they don't know that the pathology will be. How can I say, they're gonna die for this disease,
Hmm.
and I think that they finally, at the end, they are not. At least the patient that I saw, no, they
Hmm.
don't realize that they are they are dying in the
Hmm.
future. Maybe it's important to talk with the family in this
Okay.
case. Always, it's important. I need. We need to talk to the family any many times.
Maybe when talking to the family, maybe you have some advice how to approach them, how to discuss the future care of their dying family member.
According to the once again, according to the pathology,
Hmm.
mm, it's difficult to give one example. But if you have a patient with a like a glioma tumor, you need to
Hmm.
talk to the family according to the prognosis of the disease, and tell you the truth. Surgery could give you a more survival time, but it's not a cure, unfortunately.
Hmm.
Um, Another thing that is important to talk about the quality of life is very
Hmm.
important. And talk to the patient and family and say the truth, and then just keep with the patient. Keep the relation,
Hmm.
patient, the family.
We discussed previously about thinking about the things that we are not doing. For example, in a surgery, if something goes wrong, we can do better. I was wondering how important is, in your opinion, self-reflection as a neurosurgeon. Can we do that, or we need an input from other people around us for that?
I think this self-reflection is very important, because it's self-reflection maybe let you improve
Hmm.
your how can I say, your performance.
Hmm.
You can always, at least in my case, every treatment I offer patient, I ask to myself, if the patient were my mother, my family, I will do
Hmm.
the same. Yes, of course, that's important. This is maybe one example. And then when I am during the surgery under the microscope, I always was thinking to do the best. I am doing the correct way. You need to take a look at the patient exams, and during the surgery. I am thinking just have, you need a high level of concentration, and sometimes
Hmm.
I self-reflection. So I do the best. I have this situation, and always you have to do at least two or three plans. But plan
Hmm.
A, B, or C. You have always to have this kind of plan. It's very important.
Now, as a neurosurgeon who has so many years in practice, so many um, work, so much work, good work that in influence in neurosurgical field, what are the challenges you face as a neurosurgeon in practice at the moment?
At the moment, my challenge is there are several ones. One is
Hmm.
to try to improve my surgical techniques. I
Still.
Yes, of course. You always can do better. I'm sure.
Hmm.
Maybe when you have, in my case, maybe more than 20 years doing surgeries, microsurgery. Yes, that you can have a little improvement. And if you are looking for a little improvement, you don't you can, at the same time, you can keep your skill and your level. So try to improve with a a new device, a new instrument, something like that, or just try to do something different. This we need to improve. Maybe another thing is the challenge. Is something that I think I can do very well is to teach. When you teach, you at the same time you learn. So I love teaching. This is maybe my favorite challenge. I love to teach my residents. I work in several places in Argentina. I have two main places. I love to teach. One of the most beautiful things is that when I saw my resident doing the first complex cases, oh, he or she was a resident 2 years ago. They didn't know how to do skin incision, and today they're clipping a challenging aneurysm. Big cone and could be challenging. So this is one of my favorite feeling when I saw that they can do very well. I said, "Oh, okay, my recipe works very well. This is my challenge today."
What do you want to achieve still in neurosurgery?
The answer will be similar to the previous one, just to keep doing complex cases. I like to do. Another challenge is maybe to keep alive vascular surgery. We should we should accept that endovascular is maybe we are in the endovascular era, especially for in some aneurysm cases, not for AVMs, not for ischemia, for moja that the vascular microsurgery is still alive, and we have many things to do for the future. In aneurysm, of course, but I think that the number of cases is decreasing now for a young. I already clipped more than 1,000, so I have a good experience, and I can offer very good results. So I will keep doing. I hope the young people can do it. This is one challenge. Another is to try to teach as many young surgeons as I can. This is the part that I would like to show or to teach modestly my microsurgical techniques. You need anatomy and microsurgical technique. You need training. You have to watch great surgeons that I can say around the world. There are many surgeons from many people, many places. Even I'm sure there are many surgeons that are extremely good, but I don't know. I'm sure there are many of them on the world.
We talked about keeping alive vascular neurosurgery. I was wondering, do you still have, or if you ever had, favorite procedure to perform?
I like so much microsurgery. Not only vascular. I do many cases of tumors and skull base. I love. I like to do. But if I have to say what is my favorite surgery, I would say that the favorite and challenging is AVMs. I like so much AVM surgery. This is the surgery that demands you to know microsurgical anatomy very well, because AVM can be found in any part of the brain, even in posterior fossa. You need the microsurgery techniques. You have to be. You need courage, because sometimes AVM could be very difficult to treat. You need a great amount of patients, because sometimes you have to deal with some bleeding. Sometimes it's difficult to 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 treat the bleeding during the AVM resection. This is maybe my favorite topic because you have to keep the anatomy. At the same time, you need to remove the AVN without trying without bleeding. Not it's always possible, but in many cases I can do it, and so I enjoy a lot when I am removing AVN without bleeding, identifying the feeders, the nidus, the drainage. Yes, this may be my favorite case, but I love to do all of the microsurgery cases, but maybe AVN is my favorite. I also like so much aneurysm clipping. I think it's wonderful when we can do it.
If you could invent a new tool for neurosurgery, it'd be anything. What would it do?
Interesting question. Um, what tool?
I think it's $1 million question.
No, no. Okay, maybe not for surgery itself.
Mm-hmm.
Maybe I like to have a device that can predict if aneurysm or AVN will broke will break,
Oh, yeah.
will have a bleed in the patient, because sometimes
Mm-hmm.
when we are doing our clinic, we have a patient with ABM grade 2, say, okay, 60 years, 70 years old, okay, you can go home, don't
Mm-hmm.
worry, and then the patient can have a
Yeah.
bleeding. And the same for aneurysm, 5 millimeters, and don't worry, it's less than 5 millimeters. The border are regular shape, so don't worry. And maybe
Mm-hmm.
patient have a. But now with some a new MRI, you can predict, especially for aneurysm.
Mm-hmm.
You can predict more acute if the aneurysm will bleed. But this is one tool I would like to have. And then another tool is something that can control the hemostasia much better.
Mm-hmm.
Polar
Yeah.
than bipolar, than cotton, than decrease the, the pressure of the patient. Maybe this is, for me, this is the best tool we can invent. Is something that we can stop the bleeding uh,
Mm-hmm.
immediately. It will be the best, and then you can do, because as I told you before, to have a very good surgery, you need microsurgical techniques, a good microsurgical technique, a deep anatomical knowledge, but
Mm-hmm.
all of them in a clean surgical field. If you have bleeding, if you don't keep a good hemostasia in the surgical field, you lose anatomy, and you lose even the microsurgery, because you don't know where you are, and this is very
Mm-hmm.
dangerous. So for me, uh, something to to keep hemostasia will be the best tool. Of course, we have some tools: anatomy,
Mm-hmm.
surgical techniques, bipolar. We have some device, but maybe something better.
Okay. And as my last question, I observed that neurosurgical community in Argentina is very united compared to probably other countries. What do you think has contributed to this unity?
I think that could be part of our country culture,
Mm-hmm.
but I have I think I have the lucky to travel around the world, but I think that I couldn't find bad relationship between colleagues in other countries.
Mm-hmm.
I think that it's not, maybe could be related with the culture, but maybe it's a personal situation. Hmm?
Okay.
You have to do, you have to work and just You need to worry about you, your patient,
Hmm.
right, and try to help the people who are working in the same community with you. And say some, I don't have this problem, so I just try to help everyone. Uh, I feel find this kind of this the unity you mean. Maybe I saw in many places, and it's part of the life. You know you cannot have friends in everywhere, but even here in my country, I don't have friends in neurosurgery. All of them are my friends, but uh, it's impossible. I don't expect that they want to be my friends. But one thing that I think one thing is very important. I must respect my colleagues. This is 100%. I have to respect. Maybe they're not my friend. I'm not friend. But it's not only here in around the world. But it's
Hmm.
important to respect your colleagues because they are your colleagues, and first of all because they are person. So you have
Hmm.
to see. But it's something that you cannot learn from the school.
Yes.
Respect the people you learn from your family. In my
Hmm.
case, my parents, they taught me to respect all the people, no matter the position. This is my at least my policy. Mhm.
Thank you so much. It was my
Okay.
pleasure to talk to you, and hope to see you soon.
Okay, thank you very much.